So welcome to Let's Talk About HIV. This month we're talking about sexual health, and we have Hilary, who is she's running a sexual health clinic at Body Positive on Tuesdays going forward. And one of the reasons we're doing that is because rates are going up and we need people to have access to testing, so that's why Hilary is available to do that for us, which is excellent. So welcome, Hilary. We're sponsored by Merck Sharp and Dome, who provide the facilities, Vive, and MacAIDS as well. They've funded us as well, which is great. So thank you. Thanks, Hilary.
Thanks, Mark. Thanks for the opportunity to talk about gay men's sexual health. It's a subject that I'm really passionate about, and really I'm looking forward to starting again at Body Positive. So basically my name is Hilary Gerard. I am a registered nurse, but I'm also a counsellor, and I work for the New Zealand AIDS Foundation at the Burnett Centre. So for 4 days, so it'll be all exciting to incorporate the sexual health again. So look, the presentation, this is what I want to talk about. It's just about sexually transmitted infections that the levels are not going away. They're quite consistent. And I have included HIV in my presentation because, it is, let's talk about HIV. So basically, this is just going over old stuff for a lot of people, but HIV is found in blood, semen, anal mucus, vaginal fluids, and breast milk. And regards to gay men, and when I use the term gay men in my presentation, I am really trying to cover all men that have sex with men, and that covers a wider community. So I just want you to be aware of that. But the unprotected receptive, or being in the bottom, anal intercourse is the highest risk activity for gay and bisexual men. And studies have shown it's 18 times riskier than vaginal sex. So that's quite a large difference, I think, as well. And if we look at why that is the case, anal tissue is highly absorbent and it acts like a sponge, so anything that goes into it is quickly absorbed. So that, basically, just because anal sex can be a bit more traumatic at times and there's blood-to-blood contact, then obviously that's why it is a higher risk. And we do have to think about, in the New Zealand setting, that there is 1 in 5 gay or bisexual men that don't know that they're HIV positive. That's because possibly they haven't tested, but a lot of them, that could be at the seroconversion stage, that they're having risky sex, and that's when they're the most infectious. So that's something to be aware of as well. And there is a small pool of partners in New Zealand, so that's why it is a higher risk for this community as well. Chlamydia, I always think of this, it's not a flower, because people always wonder about, when they see the spelling, I think they see something else, but it's a very common STI, which is easily treated, which is fantastic. Again, the thing is, many people don't know they've got it because of no symptoms. So that is, there's no discharge or no problems peeing, anything like that. So that's why I think there is such a high rate, because nobody knows they've got it. But it can, in some people, cause soreness, discharge and itching at the opening end of the cock, or pain when pissing. So, if you've got any of these symptoms, please think about getting checked by a doctor. And, sexual health doctors are really the best people to go to, because they know where they should be swabbing, and they're very used to talking to you about your sexual health. Also, some people have unusual discharge or bleeding from the anus, and that can be indicative of chlamydia. And if you've had it for a bit longer and it's never been treated, you can sometimes have pain or swelling in the balls. So it's an easy thing to test for. It's just the first stream piss, so it's not as if you have to get that swab down your penis that everybody dreads. But it also can be in the throat, so that's something to think about in oral sex. Chlamydia can harbour in someone's throat, and it can be passed from the throat to the urethra quite easy in oral sex as well. And also an anal swab, because of anal play, sex toys use. That's another place that it should be swabbed as well. Gonorrhea gonorrhea and chlamydia, for me, it's the two things that go hand in hand because they're usually tested for together. So it's a kind of same swabs, same urine test. You know, the thing that worries me about gonorrhea the most is the fact that that it's a very common STI again, but unfortunately in some countries, and I'm sure it'll be in New Zealand at the moment, but nobody's really maybe tested for it yet, but there is an antibiotic resistant strain. And at the moment it's ceftriaxone, which is an antibiotic that's given as an injection to treat gonorrhea. But if we get this antibiotic resistant strain, it'll be much more difficult to treat, and really the specialists don't really know what they're going to use, and I've just discussed that again with a GP very recently. So, you know, that means we could have gonorrhea that's not treatable, really, and that's quite a worry for, I think, all the community really as well. Men are more likely to notice symptoms than women because of discharge. It's usually kind of a green pussy discharge as well, and you're aware of it because it sticks to your underpants. You know, men should never have any discharge. The only thing that should really come out of a healthy penis is urine and semen. So if you've got anything else, you've usually got an STI, and I suggest you get yourself to a doctor and check it out. Again, as I say, discharge, pain when you're peeing, or pain or swelling in the balls is another thing, but it can go with gonorrhea as well. You know, if it's rectal gonorrhea as well, it could be a discharge or bleeding from the anus. So as I said to you, it's just the same screening as chlamydia. So it's throat, anal, or urethral swab, or a piss test. So it's first void. Now for both these tests, if you're doing a piss test, the most important thing is if you go to the doctors, don't pee for about at least an hour before you go. So that because they want to pick up the cells that are harbouring around the urethra, and that's where, you know, the infection is. So that's the most important thing to remember about. Now syphilis, you know, I always think, a lot of the time I think about HIV and syphilis together because a lot of people have the co-infection. So I do testing, I do rapid testing for HIV and syphilis, as well as the counselling and the STI screening. So when I see a positive syphilis, because I read that 10 minutes before I read the HIV test, I always get nervous because I always think that it could be a positive HIV as well. So, you know, it's an easy infection to catch. It's through skin-to-skin contact and also sexual contact. The biggest thing about syphilis is it's different stages of it. So first of all, you have painless sores. It's like ulcers. They're called chancres is the medical term for it. So it's like ulcers, but you don't have the pain. So a lot of people are not aware of it, so they don't do anything about it. And these can be in the cock, anus, or mouth, depending on the sexual contact. And then that they go away after 2 or 3 weeks, and then the secondary stage is a rash. Now, this rash affects the palm of the hands and the soles of the feet. So the minute anybody says anything like that to me, that's what they've got, I immediately think of syphilis. And the good thing is, though, it is treatable with penicillin injections. And again, the best place to be treated is a sexual health clinic because they've always got the penicillin injections. GPs tend to not always have them in their surgery, and they have to order them in. So, you know, you want to treat syphilis as quickly as possible as well. And, you know, like chlamydia and gonorrhea and syphilis, the one thing we have to consider is contact tracing. So basically, all previous sexual partners, especially over the last 3 months, should be contacted and advised if you have any of these infections, because they should get tested and treated as well. So that's about, you know, protecting the community, the wider community as well. But, you know, also with the syphilis, you can have mouth ulcers. If it's in your mouth, you can feel quite unwell. And again, I think that goes on when it's not been treated. So, you know, if there's anything that's different about your health, you know, please go and see about it. Yeah. This is one that some people, doctors say you've got non-specific uritis, and what that means is they have tested you for chlamydia or gonorrhea, but nothing's come up positive, but you do have the symptoms. So most sexual health doctors will actually treat you with the same treatment for chlamydia and gonorrhea, which is the ceftriaxone injection and 2 azithromycin tablets, just that you take as a once-off, and that's it. So even though it doesn't come up, but there's symptoms going on, it's usually just because the tests aren't showing, what is there. So you'll maybe hear that term and people say, what is that? So that's what it is really. And, it can cause quite a bit of inflammation around the P tube especially. Yeah. Genital warts, yeah. So genital warts is caused by the human papillomavirus, HPV. People have heard of that term rather than the human papillomavirus. The thing about it, there's types 1 up to about 68 of HPV viruses, but the ones that cause the genital warts are type 6 and 11. And these, these are usually, they can also cause warts in the hands as well. So it isn't just always the genital area. And it can also be around your anus as well, depending on the sexual contact you've had. Now, the thing about genital warts, I suppose bringing in condom use, the one thing is that condoms don't protect you from genital warts or actually herpes as well, because it's the intimate skin-to-skin contact that when the virus has been shed, and that's how people get infected. But, if you think about HPV viruses, most people will be exposed to the virus within the first 2 years of being sexually active. But most people, their immune system deals with it, so they maybe have one outbreak and then they never have anything again, or they have no outbreaks, but they can still harbour the HPV virus, so they can pass it on to other people. But the good thing about genital warts now, there's a wide range of treatment available, whereas before it used to just be the cryotherapy, which was quite a long process, because if you had a lot of warts, you had to go weekly to get them frozen off. So cryotherapy is like frozen ice, and it just, you keep on having to, because they can rapidly grow back. So people used to have to come on a weekly basis to sexual health and get a lot of treatment before they resolved. So the Aldara cream, which has been out for quite a couple of years now as well, makes it far easier. You can treat yourself at home. So treatments get easier, which is really good to hear as well. So genital herpes, also known as HSV, so it's a virus again, and it can cause, type 2 is a genital one, and type 1 is a cold sores. But the thing about sexual contact being oral or genital, you can actually pass each type to different areas. So some people will have a blood test and without symptoms, and all that will show is that you've been exposed to it, so you've got it or you've not. But when you do have your first outbreak of genital herpes, for most people it is a very painful process and they don't forget it. So the blisters are very painful. The sores in the genital skin, it takes a few days for them to disappear, and you feel very much like the flu-like symptoms. So, and for, I suppose, men, peeing can be difficulty, but for women especially, it can be to the point that they have to actually go into a bath of hot water and pee because it's so painful. So, most people never forget their first outbreak of herpes. Okay, but the good thing again, it's treated with a tablet called acyclovir, and in the initial dose you have it for 5 times a day over a week. But some people then go on to have frequent outbreaks of it, so they sometimes require treatment on a daily basis. So it's a preventative, a prophylaxis, so it's to keep it at bay, and that's about 400 milligrams twice a day. And this is a very safe medication to take, and some people are on it for years and have no ill effects from it, no big side effects from it as well. So that's genital herpes. I'm going to talk now about hepatitis A, B and C, because I think especially for gay men, I don't know if people are really aware of how it can be picked up through sexual practices like rimming and sharing of sex toys. It's something always people think about travelling, I think, really, because that's the only time the vaccine is really offered to a lot of people, and I think in general practice. But if you're a gay man and you're sexually active, I really think hepatitis A vaccine is a very good thing to have. And it just involves one vaccine and then a booster at 6 to 12 months later. Now, as far as I'm aware, Sexual Health in Auckland used to offer the cheapest vaccine, because GPs can make it quite an expensive vaccine to have, really. So, yeah. But, you know, that's the Sexual Act, that's how it's passed through. But, you know, if you're travelling as well, contaminated food or water is usually a way of it, you can pick it up. So it means if you're protected, if you go travelling or your sexual activity, you're protected both ways. So I think it's a win-win situation, because people can be quite unwell, because it is a virus that affects your liver as well and can make you feel quite sick and just generally off for quite a few weeks, actually. With the jaundice as well, the yellowing of your eyes. Hep B, Hepatitis B, you know, I think this is the one of the hepatitis that's really forgotten a lot about. I don't hear a lot of people talking about the same, because Hep C has become more of an issue and more talked about. But, you know, Hepatitis B is, you know, a much powerful virus that compared to HIV. So to give you an example, you know, HIV, when it leaves the host body, it dies off very quickly. Nobody's ever been able to measure the time, but, you know, I would say within an hour it's likely dead. Whereas Hep B has been found in dried blood up to 2 days after it's left the body. So, you know, it's also in all kind of body fluids as well. So urine, feces, sexual fluids, blood. So, you know, I think it's a bigger risk, and it's something that people don't talk about. So also the sharing of intravenous drug equipment, and also if you're a sexual partner of a carrier, you know, it's a good idea to have a hepatitis B vaccine. But especially, I think, for gay men, multiple partners, you don't know their status. You're not going to ask them really, nobody really asks about the hepatitis status. A vaccine's just the easy answer, and then you don't have to worry about it. So that consists, a lot of people in this country, it came into the childhood vaccination schedule in 1986. And, you know, check with your doctor, just have a simple blood test, and it'll tell you whether you've still got immunity or not. But if you don't, it just involves 3 injections, so 1, and then the second a month later, and then third at 6 months. And then it's a good idea to check your blood levels again, just to make sure you've responded to the vaccine, because some people do need a second course, you know, and then they get protection that way. So that's hepatitis B. Yeah. Hepatitis C, I think it's become very trendy. It's because, you know, there's now new treatment available, which is the positive thing about it. It's wonderful. If we look at, you know, Auckland, I can only talk about Auckland, but I know that there's at least, likely possibly well over 100 people that has co-infection with hepatitis C and HIV. So, you know, I think it is in everybody's favour to get tested at least once a year for hepatitis C. You know, we're in an era of the chemsex parties. We've got sharing of drug equipment far more regular. That is the biggest risk. And, you know, I think we really need to start really testing very regularly for hepatitis C in the community. Sexual contact between men does carry a risk. I think some practices are maybe a bit more riskier than others. Obviously unprotected anal, where blood-to-blood contact, that's a risk. And also that's the thing about the chemsex parties. You know, there's a lot of sex goes on, there's a lot of partners, it can be quite traumatic, and I've heard quite a lot of stories about, you know, people seeing quite a lot of blood there. So obviously, you know, I think hepatitis C is becoming a bigger risk in the community. But, you know, in general, you know, something about sexual contact in general, you know, I think in just, if you don't have multiple partners, you're in a monogamous relationship, I think the risk is really a lot less. I think it's actually unknown really how much a sexual contact is a risk for Hep C. I don't think really anybody has really measured it appropriately at this stage, really, to be honest. But, you know, if you're positive, you're more at risk if you're HIV positive, or if you have another STI already there, like chlamydia, gonorrhea, syphilis, you know, the risk is higher. So there is no vaccine available, unfortunately, at this stage. But, you know, there is new treatment being trialled at Auckland Hospital Professor Ed Gain is a big guru in hepatitis C, and as far as I know, there is access to treatment for quite a large amount of patients now, which is good to hear as well. So that's kind of just a quick run through all the STIs that everybody could have possible exposure to, and just a bit about the symptoms and a bit about the treatment as well.